the people I feel worst about are the hospital workers, the nurses, ICU staff, who are now thinking that they were seeing the last of the ICU admissions because a lot of people were vaccinated, and now realizing that so many people, young people, were defiant of vaccines, and now because of the Delta variant, they're coming into intensive care units, and that I'm sure is extremely demoralizing, and even a component of PTSD, I'm sure, associated with that. And the tragedy is everyone who's in a hospital right now from COVID was there by choice. They could have opted to vaccinate, and I think that's extremely frustrating. So the key now is to really elevate our levels of vaccination. We're doing pretty well in the Northeast. We're doing terribly in the South and terribly in the Mountain West, and that's got to pick up.
Thank you.
If you're unvaccinated, you need to get vaccinated. That's got to be your number one priority. That's getting those virus neutralizing antibodies on board are going to keep you out of the hospital. Certainly, if you're unvaccinated, you have to wear a mask at all times in public when you're indoors or in crowded outdoor settings. But now, I would say for now, the same with vaccinated individuals. You may have to re-don masks until we can sort out the level of virus transmission going on. As Rochelle Walensky, the CDC director, has said, this is an epidemic of the unvaccinated. The problem is this, even though the vaccines seem, if you're fully immunized, seem to be holding up very well against symptomatic illness, moderate and severe illness, and keeping people out of the hospital. The hope was, based on original lineages, that these vaccines would also halt asymptomatic transmission to other people. And now that's been put into question because of the higher amounts of virus in the upper airways. And that's something we're going to have to follow closely, particularly for parents of little kids, of where the parents are vaccinated, but they could still be shedding virus to infect their children, and or school teachers infecting children who are vaccinated. And so that's one of the big unknowns. And therefore, I think we're going to have to look into whether a third immunization of the mRNA vaccines becomes warranted on that basis, or a second dose of the J&J vaccine. Overall, older Americans are better vaccinated. So I suspect we won't see as many deaths because the death rates from COVID tend to be somewhat lower in younger people. But we're still going to see a lot of illness, and we're seeing a lot of young adults being hospitalized, even with ICU admissions this summer. So that really concerns me. Some, unfortunately, will lose their lives, and almost all of those are unvaccinated individuals.
I like that you made that. Except Lily, can you erase the board for us, please? Okay. On page 679 of your.
We are now seeing a rise in hospitalizations, a rise in ICU admissions, and as I say, the character is different. It's more younger people who are coming into hospitals. We're also now seeing a rise in number of pediatric ICU admissions, and so that gives me a lot of pause for concern. If there are breakthrough cases, they should not be common, and almost all of them will be asymptomatic or mild. The unknown is whether this could set up, whether these individuals who are vaccinated could still serve as reservoirs of virus transmission, because in the past they weren't. And so that has a lot of implications for behavior in terms of whether vaccinated individuals can still feel comfortable not wearing masks in public, and including indoors. And so I suspect we may see some revisions to guidelines coming from the CDC.
Just to break free, this one actually is a little.
This has been the modus operandi of the variants of concern. So the same thing happened with the UK variant, the B.1.1.7 variant. It quickly became the dominant variant among the different virus isolates, and Delta's 50% more than that. So in terms of transmissibility, so we knew we were in for trouble, and this is why now we're seeing COVID-19 surge again this summer, particularly in areas where there's low vaccination rates, especially in the South. So that appears to be the epicenter. Ironically, this is exactly what happened last summer at this time, a big surge across the South. And this is why I predicted it, and I've been mocked, especially on Fox News even the governor of Florida for it. But that unfortunately is the reality.